Saggy, puffy eyes can make you look tired, older, and overworked, but eyelid lifts can bring back that energetic, youthful appearance and make you feel more confident. Here now with more about the life-enhancing benefits of eyelid surgery is Dr. Nadia Ovitch of Belcara Health. Welcome.
Thank you.
Happy to have you here. So tell me
Glad to be here.
about this eyelid surgery. It's got a difficult for me to pronounce name. What is it called?
So it's called a blepharoplasty. We often call it a blef for short in the industry, so that makes it a little easier. Yes. So what eyelid surgery is, it can be a procedure done on the upper eyelid, on the lower eyelid, or both sets of eyelids, depending on the unique concerns and anatomy of the patient.
So why would someone say that they want to have eyelid surgery?
Sure. So one of the most common complaints that we get is someone saying, well, my eyes they make me look so tired even though I had a full night's sleep. Or they might say, my eyes, make me look so much older than I actually am. So it's not necessarily that they come in saying, oh, I want eyelid surgery. They come in with those complaints, and then I do an evaluation and notice that they have certain signs that contribute to those feelings. And some of that might be excess saggy skin of the upper eyelid or chronic puffiness of the lower eyelids.
And we have some examples of people that you've treated, because what I like about this surgery is that a little bit goes a long way. It's a subtle difference that makes all the difference. So show us tell us what we're seeing here.
Yeah, so what we're looking at here, this is a picture of a patient that had an upper eyelid procedure performed. She had excess kind of heaviness of the upper eyelid skin that you can see just even kind of weighs down her eyelashes and her eyelids. And so just a simple procedure to remove that excess skin goes a very, very long way and just kind of opens up and refreshes those eyes.
Yeah, it's just a little, because I looked and I was like, where is it? And then you see it, it's like, it does. It just sort of opens up.
It just opens it up, exactly.
Without being a drastic overhaul.
Right.
I'm sorry, go ahead.
I was going to say, many patients don't want to look overdone or look too surprised, and the whole point of this is just a subtle, refreshed look.
Absolutely. So who's a good candidate? Because I feel like there's different ages, men and women. We're seeing a man here now, and he's got upper and lower.
Exactly. This is a male patient who was having the same kind of thing, heaviness of the upper eyelids, but chronic puffiness of the lower eyelids, what people will call bags under their eyes that just never go away. In general, in terms of who's a good candidate, patients do need to be healthy. This is an elective procedure.
Right.
So we want to make sure that they can undergo the procedure, have the time to recover, and have good expectations about what the potential outcome could be.
And with this eyelid surgery, and you were saying that some people might come in and it's a genetic thing, or it is when they get older that they decide that they need this. So here, I mean, every time I see these pictures, I'm amazed, because it's like they really did take off years off their life.
Exactly. So what we like to say is these procedures are not meant to make somebody who's 60 look like they're 20, but the point is just to turn back the clock, and it does exactly just that. So it refreshes, opens up the eyes, and creates a more youthful look while still looking natural.
And I touched on it, but then I got distracted by the photos. I was saying it's for every age, because you might have these issues with your eyes and be a younger candidate.
That's correct. So some of these conditions can actually be genetic. Some people are predisposed more than others just based on their history. I have patients who say, my father had this done, my mother had this done. And so there really can be a genetic predisposition. This patient shows, this picture shows a younger patient who just always had kind of chronic puffiness of her lower eyelids. And so she benefited from a lower eyelid procedure.
That really is amazing. Now I'm wondering about how we pay for this. I think a lot of our viewers are wondering about it. Does insurance cover it?
So that's a great question. Typically, eyelid surgery is a cosmetic procedure. Some patients who have so severe hooding of the upper eyelid skin can actually develop a visual field defect, meaning that they can't see some of their periphery because of the overlying skin. So in those cases, there's a chance insurance may cover the procedure.
So come to you and you'll evaluate it.
Yes.
And then as we're wrapping up, I do want to ask you too, what can people expect from the procedure, sort of that recovery time and what will happen?
So recovery, it's a very well-tolerated procedure. Patients typically have some minor swelling and bruising for a few days. I tell everybody to limit strenuous activity for 7 to 10 days, but most people are back to work within a week.
All right. Well, for more information or to schedule a consultation, you can visit belcarahealth.com or call that number on your screen. Thank you so much for being here. And we'll be right back with more Midday Maryland right after this. Stay tuned.